And now, time for the injury report brought to us by our great friends at Rothman Orthopaedics. Listen, I tell you about Rothman all the time, and there's a team for everybody. Each body part has a team of doctors, like the greatest doctors with us. Today, we have a doctor who specializes in shoulders, right? Because of Jalen Carter, the whole thing. I got Dr. Fotios Tjoumakaris. Did I get it right?
Close, yeah, it's pretty good. That's pretty good.
Give me your pronunciation so I can get it.
Well, the Greek way is Tjoumakaris, but Tjoumakaris is how we say it. But everybody always calls me TJ, Dr. TJ, because I've been.
What part of Greece, Doc?
Well, my dad's from northern Greece, so kind of in the mountains of the northlands of Greece.
Oh, wow.
So not anywhere nice to visit, unfortunately. Not the islands or anything like that. So we have to do that, but then also like visit where he's from, which is beautiful in its own right. Like the mountains are nice.
Is it a lot of olive oil?
A lot of olive oil, a lot of oregano, the Holy Trinity. Lemon, olive oil, and oregano. That's the Holy Trinity right there.
I love Greece. First of all, the culture is great. The people are incredibly warm. Doc, it's a beautiful culture. I love Greece. Love it.
Love it too.
Do you still go back? Do you have family?
I do. Can you hear me still, Anthony?
Yeah, I got you.
Yeah, I do. I still have family there. My dad has his brother there, and I've got like aunts and uncles and all that stuff. So we go back quite a bit.
Oh, that's awesome, man. What a great gift. That's great. Doc, I could talk to you about that all day. All right? Seriously.
Yeah.
You're a great sports guy. Jalen Carter, the shoulder. So explain to us everything about this from the non-invasive procedure, still procedure, but not invasive surgical procedure the way it is. Enlighten us, Doc.
Well, from what I understand, he's suffering from issues with his shoulders, and I don't have all the details. We're not the treating physicians for the Eagles. But the idea is that he's going to get some sort of probably ultrasound-guided injection procedure. A lot of times that goes around platelet-rich plasma injections. And so while not a surgical procedure, still something that may require some time to get some healing from. So, and we can talk about PRP or platelet-rich plasma and what that is and how that works. And, what that is you take some blood from a patient, you spin down that blood, and there's little platelets in there, which is a clotting factor in your blood, in your red blood cells. And you get the granules from those. And there's a lot of growth factors and cytokines and things that can sort of augment the healing response. And the hope is that by injecting that into an area of damaged tissue, that you can get a biologic response, which will be inflammation and subsequent healing. And that process takes a little bit of time. So it's not like, hey, you get this shot and you're better right away. It's you get this shot, you get that inflammatory response, and then you get that delayed healing response beyond that. So the hope is that, you get it to the targeted area, usually with like an ultrasound to make sure that you're in the right area, whether it's a partial thickness tear of the rotator cuff, whether it be an impingement or tendonitis, and then you allow this ample time to inflame and then heal. And that's sort of the hope, is that you can treat these in-season injuries like that, try to get some healing during the season, and then get someone back to where they feel better and can still compete at a high level.
It's funny, Bryce Harper is getting that blood spinning done in the off season because he's had the wrist, his shoulder. So to your point, it promotes healing. What's the difference? Just the basic difference between a procedure and surgery.
So surgery is more invasive, right? So and even if you're having a minimally invasive surgery, it's still going to require some level of anesthesia, whether that be general anesthesia or a nerve block or something like that to help numb the area. And there's going to be a more extensive recovery time. Typically, you're going to intervene. You're going to grab tissue, bring it back to bone. You want a more robust healing response. You're going to have to immobilize somebody afterwards. So, whereas a procedure is more something that can be done less invasively, whether it be a needle, whether it be some other ultrasound treatment, or even some people do shockwave therapy, things like that. It's not going to be as invasive, not at an extensive backside of healing and immobilization.
So when you're dealing with a shoulder, just in general, again, you're not the treating physician, but just in general, you're talking about a defensive tackle, you're talking about his shoulders, right? So you're talking about a lot of pounding, run game, the whole thing. How do you know when he's ready? Like, what are some of the benchmarks that tells you he's ready to go?
Yeah, that's the toughest part, because there's nothing that really simulates that level of gameplay that we're going to do in the office, right? So we do things first, the very simple things like, is there swelling? How's the range of motion? When we palpate the area, does it hurt? So that's just the basic things that we're going to do in the office. Then we're going to do some simulated muscle testing. How's your rotator cuff test? How's your shoulder move throughout its arc of motion? Then we could do some loading, like, okay, well, can you do push-ups? Can you do pull-ups? Can you push a sled? Can you move away from objects? And so there's this return to play criteria that the trainers and the physical therapists will put athletes and patients through. And certainly it's way more aggressive for an athlete getting that high level of play. And then you do practice, right? You go from that stage to, okay, you've cleared those metrics. Maybe you've got a little bit of post-workout soreness, but we don't think anything serious is going on. And now we'll let the athlete practice, and we'll observe him in practice. How does he feel? Light reps at first, then going full reps, and you see how they progress from there. And then the game is even the next step, right? So in the game, as he goes back and you see him play, how's he moving? Is he getting off blocks easily? Is he pushing guys to the side like he used to? Because when your arms are really far away from you, that's a very rotator cuff dependent activity. And if you're going to load with your arm away from you, that's going to be a lot of strain on the shoulder. And so you just have to see how that manages through practice and gameplay.
Yeah. Doc, great stuff, man. Excellent stuff. I could talk to you all day. In fact, I want to have a session talking about Greece one day with you. All right.
I love it. I could go on and on.
I love it. It's I gotta tell. I actually wrote a movie about olive oil, and it goes through Greece and Italy, and little Spain.
Yeah. Well, it's interesting. A lot of the olive oil that comes out of Italy has come from Greece because the Italians are much better at exporting. So
yes, I read that because it's so plentiful in Greece that they know how to package it in Italy. So it's like a half of, I saw the same thing.
That's Italians and Greeks working together. What's better than that? That's great.
Perfect. Listen, I want you to have a blessed holiday, brother. All right?
Thanks.
Thanks for hanging, man. You're terrific. Appreciate it, Doc.
Always a pleasure. Thank you very much.